What is Medicare? Medicare started in 1965. It is a government-sponsored health insurance program for people meeting certain eligibility requirements. Medicare is broken up into many parts that cover various types of care and services, which we'll talk about in this recording. So, who is eligible for Medicare? Typically, for someone who is age 65 or older and has worked at least 40 quarters, which is the equivalent to about 10 years. You must also be a U.S. citizen or legal resident who has lived in the U.S. for at least 5 years in a row, including the 5 years just before applying for Medicare. You also can be younger than 65 with qualifying disabilities and at any age with a diagnosis of ESRD or ALS. So why think about Medicare? That's the biggest question. So when you reach the age of 65 or have qualifying events, you'll need to consider if it's the right time to enroll in a Medicare plan for your health coverage benefits. There are many factors you need to think about whenever you make this decision. Are you ready to retire, which means you'll need to choose new health benefits? Or have you decided to work past 65, which means you may be able to continue to receive health benefits from your employer? Today, we'll make sure to go over all that for you. So where do you begin when you understand Medicare? You want to talk about understanding your Medicare options. You want to think about your current situation, and you want to decide on the Medicare option that is right for you. So let's start with understanding Medicare. What are all your options? So today we are going to cover Original Medicare, where Part A covers hospital care and services, where Part B covers medical care and services, including preventative care. We will cover Part D, which provides coverage for prescription drugs, Medicare supplements, along with Medicare Advantage plans. So Part A, I'm sure everyone has heard of this. Part A helps cover your hospital stays, skilled nursing facility stays, home health care, and hospice care. Even though it says hospital, it really means facility charges. When you are in a hospital, Part A covers your facility room, your bed, your food, the equipment in your room, and facility charges. But whenever you receive certain services provided by a healthcare provider, it is covered under Part B, or medical insurance. Part B covers the healthcare provider services, outpatient care, home health care, diagnostic tests, preventative services like screenings, shots, vaccines, and yearly wellness visits, laboratory services, and durable medical equipment, such as wheelchairs, walkers, and hospital beds. A few things that Medicare does not cover, Original Medicare does not cover, include prescription drugs, dental, vision, and hearing. So what is Part A? When you sign up to begin receiving your Social Security benefits and reach your 65th birthday, most people will automatically be enrolled in Part A. For those who have worked 40 quarters, or about 10 years, there's no premium for Part A. If you've worked less than 40 quarters or 10 years, you may have a premium. As mentioned, Part A does not have a premium for most people, but it does have deductibles and copays when you use its services. The deductible is $1,716 in 2026. One of the unique things about Medicare Part A is that the deductible is per benefit period, not an annual deductible like you may have with your employer group insurance. A benefit period starts when you are admitted into the hospital, and it ends after you have been out of the hospital or facility for 60 consecutive days, which means you can have multiple benefit periods in a single calendar year. After you've paid your deductibles, there's no copays for the first 60 days of hospitalization. But if you are in the hospital longer than 60 days, there's a copay of $434 for each day in 2026 for days 61 through 90, and $868 a day for each day for days 91 through 150. Beyond 150, there is no coverage. So we went over Part A. Now what is Part B? Once you enroll in Original Medicare Part A, you can typically add Part B for medical insurance. Medicare Part B has a monthly premium, which is $202.90 for most people in 2026. If your income is above a certain threshold, you may pay more. And if you need assistance, there are programs that can help with this cost. Medicare Part B has a deductible is $283 in 2026 and an annual deductible. After you've paid this deductible, you have a 20% coinsurance for most services. That's a fairly typical 80-20 split. But it is important to note that the 20% is based on the negotiated amount, not the billed amount. So you may have doctor's appointments that bills are at $200, but the approved amount is $100. You would be responsible for $20 if you've already met your deductible. Depending on your medical needs, the 20% may be something that you can pay out of pocket. However, if you have chronic conditions or a medically catastrophic year, the coinsurance can add up to thousands of dollars. The unpredictability of coinsurance is why many people consider adding additional coverage beyond original Medicare. So what is a prescription drug plan? So prescription drug plans, also called Part D, is a standalone plan that you can add with original Medicare. Part D covers the cost of prescription drugs, including many of the shots and vaccines recommended by your doctor. It is sold by private insurance companies and is compatible with Medicare supplemental insurance plans, Medicare cost plans, Medicare Advantage private fee-for-service plans. And if you're considering enrolling in a Part D plan, you also want to keep in mind Medicare has defined the types of drugs included in a Part D plan, but that does not mean all drugs are covered by your plan. Look at the formulary or drug list that the plan covers. Medicare sets a standard design and designs the type of drugs that must be covered. However, private insurers are able to determine what specific drugs they will cover and the cost share or copay tier. You must live in the required service area for these plans, and you can enroll in Part D if you have Medicare Part A or Part B, which means you can select a Part D plan even if you have Part A but have not taken out Part B yet. So let's take a little closer look at your options. So option number 1 would include supplements. Medicare supplemental insurance, also known as Medigap, can help pay for your out-of-pocket costs not covered by original Medicare, such as the 20% coinsurance for Part B. It is sold by private insurance companies and is compatible with any standalone Part D prescription drug plan. It is not compatible with the Medicare Advantage plan, which means you cannot have a supplement and an Advantage plan at the same time. Medicare supplements typically have a higher monthly premium, and you get access to providers who accept Medicare and typically have little out-of-pocket cost for healthcare services. Now, what about Medicare Advantage, or also called Part C? This is what we consider an all-in-one plan. All-in-one plans include hospital and medical coverage found in original Medicare and usually include prescription drug coverage. This is sold by private insurers, and it often includes other benefits not covered by original Medicare, such as dental, vision, hearing, and fitness benefit. They typically have lower monthly premiums, but they have a higher out-of-pocket cost, such as copays and coinsurance. They typically come with the maximum out-of-pocket for both prescriptions and medical, and they typically have smaller networks for providers than original Medicare or Medicare supplements. They also come in a variety of health plan models, which you're likely familiar with, such as HMO, HMO-POS, PPO, and private fee-for-service, or PFFS. There's also such thing as a special needs plan, which are for people with special needs due to chronic conditions or during their facility stays like a nursing home. And there are also D-SNPs for people who are eligible for Medicare and Medicaid. To be eligible for a Medicare Advantage plan, you must live within the service area offered by the plan, and you must have Medicare Parts A and B. So these are all the choices that come with Medicare. As you can see, there are many different options.